Instances of healthcare worker absenteeism have been a recurring concern, raising questions about the effectiveness of current supervision practices.
We know that even despite the recent increase in salaries, the enhancement, our staff have not changed significantly in the way they work. Now, I will not attack the health worker. I will attack the supervisor. Because how do you pay this man every month? He comes 2 days a week, and at the end of the month, you give him a full salary.
Nonetheless, the Ministry of Health has reasserted its commitment to implement measures aimed at curbing absenteeism and improving overall performance.
And there's also the proposal that we should have contracts. Gradually, we're going to be moving into contracts. So people work, they have a contract, you have the performance expectation, and you are paid against or you are judged against. So your contract will be renewed against that. So, but we also need the local leaders. Actually, our biggest challenge has been the local government leaders. Because for us, we can be there, but we may not be there full time. The local government leaders need to take on their roles.
In a related context, researchers at Makerere University College of Health Sciences say there is a need for extra effort to bridge the gap between policy formulation and the implementation at all levels of the healthcare system.
At many implementation units, most of them have the policies and they are in the cupboard. The guidelines are in the cupboard.
The policies are not communicated. So you can find that the policy will spend so much time, but it has not reached the user, or it has not been packaged properly. And that is something we work on, we are still working on.
Researchers say their studies show that many guidelines and policies on reproductive, maternal, newborn and adolescent health remain unimplemented, which bars efforts to achieving critical set targets.
Most of the implementers, let's say if you look at a clinical officer, a midwife, even some doctors, they don't know that what they are working against. They wake up and do what they were taught in the medical school, not knowing what the policy is, what are you trying to achieve.
While the Ministry of Health data highlights improvements in various reproductive indicators, such as reductions in maternal and infant mortality over the last 7 years, there are still more efforts needed to meet targets to achieve global sustainable development goals. Norbert Atkunda, NTV News.